Hello, everybody. This is Betsy Wursel, host of Chatting with Betsy on Passionate World Talk Radio, where we educate, enlighten, and entertain. And I want to thank Jeannie White for writing the blog, producing the show, and for Lillian Caldwell, CEO. Folks, I have a very special guest with me today. I'm so excited. A special guest and quite a different topic. My guest today is Dr. Karen Onel, who is Chief of Pediatric Rheumatology and Professor of Clinical Pediatrics at Hospital for Special Surgery, which is located in New York City in part of the Manhattan, which is part of New York City. And Dr. Onel is going to talk about a topic I never heard of before, chronic nonbacterial osteomyelitis. Thank you, Dr. Onel, for joining me today on this snowy afternoon here in New Jersey.
Thank you so much for having me.
You're welcome. Dr. Onel, could you please tell us, I just said a little bit about your background, but your background and what is this chronic nonbacterial osteomyelitis?
So I always wanted to be a pediatrician since I was probably 8 or 10. And I graduated medical school and became a pediatric trainee, and I loved it. But I was really interested in these unusual diseases that no one really knew very much about except the rheumatologists. And they would come in when these children were so sick with unusual things, and they would come and they would know exactly what it is, and they would wave their magic wand, and they would magically make things better. And I thought to myself, that's what I want to be when I grow up. I want to be one of those people who comes in and says, huzzah, have you thought about whatever this is? And I've been doing this now for about 25 years. It's not quite that dramatic, but I've loved every single minute of it. I got interested in this disease that we're going to talk about today, which is easiest to say CROMO, which stands for chronic recurrent multifocal osteomyelitis. It's a mouthful. All of these things are synonymous, but we belong to a research network of the pediatric rheumatologists in Chicago, in the entire U.S., and it's called CARA. And we have our meetings, and we have working groups. And I went to the CROMO working group, and I started talking to the parents of patients who were there working with us. And they told me of their stories of how long it took to be diagnosed, their children, and how much they had suffered, but what really the journey was like. And I said to them, why do you come to these meetings? What's interesting to you? And they said to me, we come to these meetings because we make sure that you guys remember us. When you go on vacation or you have other things to do, that you remember our children have these diseases and you work really hard to fix them. And I was so inspired by them that I became very involved with this working group, and it's really been the most unbelievable experience. So I was really excited when you asked me to talk about this today because it's a passion of mine, because the children do take so long to be diagnosed and really go through a lot beforehand.
Dr. Onel, I love people who are passionate, and I love that the parents didn't want you all to forget them and their journeys. That's so important because I know as a physician, you learn from each patient you see.
100%.
What exactly is this disease, and is there a cure or treatment?
So chronic recurrent multifocal osteomyelitis, or chronic non-infectious osteomyelitis, is part of a group of disorders that we call autoinflammatory disorders. A lot of people have heard of autoimmunity, and sort of the classic autoimmune disease that people have heard of is lupus. You might have heard of rheumatoid arthritis. But autoinflammatory diseases are different because in autoinflammatory diseases, the immune system is just turned on and it goes crazy. Now, those of us who've been hearing a lot about COVID and a lot of conversation about cytokine storm. Well, cytokine storm is a little bit of what we're discussing here. In these kids, for reasons we don't understand, the immune system turns on, and they make a lot of cytokines, and they get very inflamed in their bone, which is really painful, but you can't see it from the outside. So that's part of the problem, is it's invisible because it's inside of the bone. They may be very sick, they may be less sick, but it's this immune system just turning itself on that is causing all of this problem.
That hurts me just hearing that. Yeah, it's got to be painful. People with lupus, people with rheumatoid arthritis, they have a lot of pain. So,
yeah.
Little children, my heart, that just breaks my heart because I don't like to see children sick. Is this only in children or is this also in adults?
So there's an association of this entity that we call chromo with some very other common disorders, such as Crohn's disease or ulcerative colitis, and psoriatic arthritis, and psoriasis. In adults, when they get similar bone lesions, it's often part of something that we call Sappho syndrome, where they have psoriasis and osteomyelitis. In kids, it tends to be mostly in the bone and not other places. But what's interesting is that sort of we don't know the answer because nobody's ever really tried to answer the question of how many people have this disease and what actually happens to them when they're no longer children. And now we're in a position that is exactly what we're going to do. We're going to figure out how many children have it, what's the best way to treat, and what happens to them when they become grown-ups.
Exactly. Because it's probably something that you don't outgrow. Just like, juvenile arthritis, they still have that, I would imagine, as adults.
They do. That's exactly right. We don't think of it as outgrowing so much, but it is a curiosity of why this is so much more common in children and young people. And perhaps it has to do with the fact that their bones really are different than adult bones because they're growing. But we know, no doubt, that there are adults. They just sort of don't get counted. And that's one of the things that we want to do. We pediatric rheumatologists want to partner with the adult rheumatologists to really clear this up and know who's out there and how best to treat people.
This is exciting news. Do you find in this disease that does it target certain ethnic populations more than others? Because some diseases do and some don't. So I'm just curious myself about that.
It's a pretty rare disease sort of all the way along. And so that ends up not being sort of as much of an issue because it is so unusual. But there certainly are some of its co-traveler diseases that we know are more likely in certain ethnic groups. For instance, Crohn's disease is much more common in Ashkenazi Jews. So there are some things like that. Rheumatoid arthritis, more in people from Northern Europe descent. But the reality is that this disease is very heterogeneous, and it's really important to think about it because if it's not on your mind, you're not going to make the diagnosis.
These children must be, as you said, in pain, a tremendous amount of pain. How is this treated? Because I would think with a child, you can't really, you have to be careful about over-medicating them with certain types of drugs, medications, which could affect them.
I'll tell you what's interesting about that. I mean, thank you for bringing that up. I might say the opposite, actually. I think people often think that we have to be very gentle with children, which, of course, we do cosmically. But again, if we think about COVID right now, the children are doing exceptionally well. It's the elderly that have problems. And in truth, we treat children with lots and lots of medications, and they handle them beautifully and in doses that are higher than adults. But if you think about it, if we don't treat these children, what ends up happening is the bones get deformed. And if the bones get deformed in a child, the bones will always be deformed. So we would say that we want to treat these children aggressively because hopefully at some point either they'll go into remission or we'll figure out the answer of how we're actually going to make them go into remission or treat them even better. And we want their bones, joints, everything should be perfect. So we have all the reason in the world to treat children aggressively and keep them functional. It's very important.
Thank you. Thank you for clearing that up because I always was thinking for some reason, the opposite, little bodies, fragile maybe, couldn't handle, but that's interesting. Thank you for clarifying that. What type of medications do you treat the children with this disease?
So there's a couple different classes of medicines that we use. We'll start with things that are simple, like nonsteroidal anti-inflammatory drugs, and that includes things that people are so comfortable with, like Motrin or Advil, Aleve, things like that. And usually no more than 6 weeks. Then you have few questions to answer. First of all, depending on where the spots are, you could have involvement of your spine. And if you have inflammation of your spine, that can be really dangerous because the vertebrae can collapse, and that's really dangerous for a growing person. So we don't even wait the 6 weeks for those people. But for everybody else, we would find out where exactly everything is, and we do something called a whole body MRI, where we actually MRI the entire body looking for areas of inflammation. After 6 weeks, if they're not better, then there's 3 ways that we usually go. The first way is using what we call non-biologic DMARDs. That's the first thing. And usually for those medications, that would include methotrexate and sulfasalazine, which are 2 medicines we've used in children with arthritis and other diseases for many decades. The second group would be people who get treated with what we call biologic treatments, usual TNF inhibitors. And those people might have heard of Enbrel, Humira, and other drugs in that class. And those are ones that we use typically to treat kids with arthritis, but they work for many children with inflammation in the bone as well. And we're very comfortable with that because we've been using them in children for maybe 20 years or so. And then there's the third group. And in the third group, we use something called bisphosphonates, and those are interesting medications because those are medicines that we use in older people for osteoporosis because it helps with thin bones. But it also helps that bone changes to stop happening for CRMO, and so sometimes we'll use those. And the reason I say these are 3 options are because we actually don't know what's best for any one person. Not yet. And that's part of the reason why we want to get organized is because we want to be able to come to an answer of what really is the best way to do that. But we can't do that unless we work together. And that's where we are now. We're working together to try and put together what we would call a registry where we would put all the characteristics of children who have this disease and try and figure out who got better with what medicines and what makes sense.
That's awesome, Dr. Onel, to help these children, help them get improved, to improve their health so they don't suffer as adults and have the bone issues that they could develop. How does someone get in touch with you, Dr. Onel, for treatment to make an appointment? Or do they have to be referred by their primary pediatrician? Or I guess it depends on the insurance.
I'm so interested in that actually because patients come to me in so many different ways. I find the parents of these children with chromo to be incredibly brave and smart and pursuant, and often people will come to me and say, I got to so-and-so, and they said you were the expert, or that person was the expert, or whatnot. We have a foundation that parents have started, so they're really good for reaching out and giving information. We have a website that some parents made with us which is so cool. I mean, really, it's an amazing website with information. And there's a Facebook group, actually, a parent Facebook group, where a lot of really useful information and communication between parents happens. And I've gotten patients referred to me from all of those locations. So from Googling to Facebook to an orthopedist referring them, or a patient just calling and making an appointment. It's all good. I just think that the key thing is that all of us want to get kids better as fast as possible. And unfortunately still, there can be a fair amount of time between the original symptoms and actually getting treatment.
Yes, and I'm sure with some insurances you have to go through the proper protocol steps, to see someone like you, go to your primary and then, do all these tests for them to approve. But I'm so glad that improvement is being done, that research is being done, and that there's hope.
Well, I think the thing is that the reason we want to get the message out there is this is sometimes what happens. So the child gets maybe some fever and the labs are abnormality and they have bone pain. And somebody actually worries that they have an infection or they have cancer, and they may get biopsied or they may get antibiotic treatment, and they get better and everyone feels better. And then a year later it comes back. And the same thing happens again, and maybe even the third year. So we want to tell people that it may not be osteomyelitis coming back. It may be this other thing, and you need to treat it entirely differently. And that's why it's really important that we talk with our pediatrics colleagues, with our pediatric infectious disease colleagues, and my friends here at HSS and around the world, the pediatric orthopedics, because they're the ones who are doing the biopsies and seeing these kids. And we want them to know, hey, this is out there and you need to treat it because it's very, very different. And my radiologists here now at HSS, they will say to the orthopedist, or you should ask Dr. Onel about this because I think that this is chromo. And that is just delightful because the more we get the message out, the more we pass the information around, the sooner the children get diagnosed and the sooner they get treated.
Yes, and I am 100% for that. And I'm so glad, Dr. Onel, and I appreciate you coming on Chatting with Betsy to share this information and to bring education out into the public. I thank you for coming on and sharing. And I want to tell the audience that you can look up the Hospital for Special Surgery on Facebook. And what is the name of the other group, Dr. Onel, with the parents?
The parents. Yeah, so you can. There is a website, and it's a wonderful website. And again, I thank so much the parents who made it with us. And it is called crmoawareness.org. And if you go to this website, which again is absolutely beautiful, there's lots of information, but there's also links on it to centers around the country that are familiar with this. It links to answers about treatment and other things. It links to the Facebook group and to two wonderful nonprofits, of course, our CRMO Foundation, which is spectacular in helping us really get the awareness out, helping us with research and education, and also Kayla's Comfort, which is from a young woman with Kayla who has CRMO, who started a foundation and sends presents to all the children who are diagnosed. One of the patients recently said to me she felt like a freak, quote unquote, because of this thing that was happening to her. And she was overjoyed to make contact with another young person who's had this disease. So we really, really thank the support of our nonprofits and the parents. And they were the ones who got me interested in the first place, and they're the ones who keep me going, them and their beautiful children.
I agree. Support is so important no matter what disease a person may have, and to know that you are not alone in your battle of this disease. It's so important. And I just want to encourage the audience, call, make an appointment for your children. If your children are having bone pain, go see your primary pediatrician, but get in touch with Dr. Onel. I just think you're amazing.
And I want to leave you. I'm sorry to talk over you. I apologize.
Go ahead.
I just wanted to say, apropos of what you were just saying, one thing is my former boss, teacher, partner, Thomas Lehman, wrote a book called It's Not Just Growing Pains. And if I were going to say there's sort of one take-home message, it's that it isn't actually always growing pains. Sometimes it's other things. And so you're exactly right. Ask those questions. 100%.
Definitely. And as a parent myself, I know that if you don't feel peace with what a physician tells you, and there's something not right, then you need to pursue it and get another opinion. It's so important. Don't be afraid to question a physician. You can go to as many opinions as you need to get that peace of mind for yourself.
100%. And you can imagine 1,000,000 times more so when you're talking about your beautiful babies.
Yeah, absolutely. Absolutely. I want to thank you, Dr. Onel, for spending time with me today and chatting with Betsy, sharing your information. I became educated, and that's what Passion World Talk Radio is about. So thank you very much. I appreciate it.
I can't thank you enough for having me on here. I cannot tell you how important it is. If one person hears this and is diagnosed and treated and feels better, it will make my year. So thank you so much.
You're welcome. My pleasure. Folks, this is why you need to subscribe to Chatting with Betsy, because you will be educated. I have terrific guests like Dr. Onel and other people who are just want to give you resources and help enlighten you on so many different topics. So I am on Chatting with Betsy, as on all major podcasts. Please subscribe so then you can become informed and you can be educated. Like Passion World Talk Radio mantra, we are here to educate, enlighten, and entertain. And that is the truth. I want to thank you, the listeners, and please have a happy and safe holiday season. And if you can't be merry, then I wish you peace during this holiday season. Thank you very much for listening. This is Betsy Wursel, host of Chatting with Betsy on Passion World Talk Radio. Bye-bye now.